In the Western Cape today. Let's get more on this. We crossed our reporter Bulelani Phillip, who's standing by in Khayelitsha. Very good afternoon to you, Bulelani. What's happening?
Well, good afternoon to you and welcome. We are here at the Khayelitsha District Hospital where we expect the President Cyril Ramaphosa to arrive at any moment to actually display about the efficacy of the rollout of the vaccine. Of course, this is his moment of displaying the thoroughness as well as the issues around the efficacy of the vaccine. He will be taking a jab right here at the Khayelitsha District Hospital. His spokesperson is Tyrone Seale, and I'm going to bring him into this conversation. Tyrone, why did the President choose Khayelitsha to take his jab?
Well, I think one is the President has been to the hospital before. We were here on New Year's Eve when the President paid tribute to healthcare workers, and I think he was very impressed with what he heard, and he was very moved by what he saw at the hospital and by the work being done here by healthcare workers. But the most important thing is that this hospital is in the heart of a community, like many others around the country, where people are positively anticipating the arrival of vaccines, not just in the country, but in their bodies, in their veins. And it's in that spirit that working with the province, Khayelitsha District Hospital was nominated as the place where that would serve as the signal in the Western Cape that the rollout has started.
Now, the vaccine that you'll be taking today, can you give us clarity? Which one is it?
Well, so that is the Johnson & Johnson vaccine. It came in from Belgium last night. It's a single-dose vaccine. 80,000 doses were delivered in this first batch, and we will progressively see the arrival of further batches of vaccine from different places in the world over the next few months, with, of course, healthcare workers right at the arrow's tip of the vaccination rollout program. And so today is fundamentally about those first few healthcare workers who will receive the vaccine.
Now, bring us up to speed with what's happening with these AstraZeneca vaccines that are said to be nearing expiry date. What's going to happen to them going forward?
Well, I think the Minister the Minister of Health dealt with that when he participated in the debate yesterday on the State of the Nation address. The Minister said that that vaccine would be shared with countries, particularly on the African continent, where infections still involve what one may consider the original virus, as opposed to the variant that we're dealing with in South Africa. And the Minister gave the clear assurance that there'd be no fruitless and wasteful expenditure associated with that sharing of the vaccine with other countries.
I guess my question is, are they going to be taken back or what?
No, so it's not a question of being taken back. It's a question of it being repurposed, being redirected to countries and to partners who will find that particular vaccine useful.
Lastly, Tyrone, before I let you go, what's going to happen now with the rollout? When do we expect the next batch, and how many people in the country are going to be getting these jabs?
Well, I think the long-term picture remains in place. That is that we're looking at close to 70% of South Africans vaccinated by the end of this year, again, starting with healthcare workers and then progressively working our way through people with different vulnerabilities, people with comorbidities, etc. But the priority in this phase of the vaccination program is our healthcare workers. So that's where that will start. The batches will arrive progressively during the course of the year as producers manufacture them and they are shipped to the country. And we are confident that that program will proceed on schedule and that we will reach the target we have set for close to 70% of population immunity by the end of the year.
The presidency must have read reports about a rift between the president as well as the health minister. Your take on that?
Well, not everything we read is true. So I think it's very clear that government has a clear plan. Government is implementing that plan by working together within itself, as government, led by the Interministerial Committee on Vaccines, that is chaired by Deputy President David Mabuza. And that committee is not just coordinating government's own effort, but that committee is working with our partners in the private sector, our partners in the international community, in the international scientific community, in multilateral organizations, including our own African Union, the United Nations, and other bodies, to ensure that we are able to fight this pandemic effectively on home soil, but also that we extend our capability as a continent in fighting this pandemic, and that we make a contribution through science and other means to the global effort to tackle COVID-19.
Thank you very much, Tyrone Seale. He is, of course, the presidential spokesperson, giving us a lowdown on the rollout plan of the vaccine. The president due to take his jab shortly here at the Khayelitsha District Hospital. Of course, that vaccine is the Johnson & Johnson vaccine. For now, we're going to take it back to studio.
Bulelani Phillip giving us an update there from Khayelitsha. We'll be spending much of the afternoon there as we wait for the president and apparently the health minister as well to get their jabs. Our reporter Vanessa Puna is also in Khayelitsha, and we'll go to her a little bit later on. Sophie Mokoena is in studio with us to discuss the vaccine rollout, not only in South Africa, but on the African continent. A very good afternoon to you. What can we expect from this afternoon, and is